Welcome to Kara's Cures, where we explore the cutting edge of wellness. I'm Kara Sundland. Today we're talking about a new groundbreaking treatment for opioid addiction. It's a new drug-free treatment. It's saving lives and making detox doable. Dr. Shelley Halligan from Aware Recovery Care is joining us now to explain. Welcome, doctor.
Thank you so much. Pleasure to be here with you today.
So people may have never heard of something like this before. It's a groundbreaking treatment called ST Genesis. Can you explain to us what it is?
Absolutely. It is from Speranza, and it's a device that is actually placed behind the ear, and it's a percutaneous nerve field stimulator. And what it does is it attaches to the ear and it stimulates certain cranial nerves to ease the detox process that so many individuals face when they're coming off of opiate medication or illicit drugs.
Yeah, we do have some video of this, so I'm hoping we can put that up and show some of our viewers. It almost reminds me, I guess only it's electronic, but the idea that I know sometimes people will use certain ear acupuncture. Is it just that we have certain pressure points or nerves, or why is this helping?
It's very interesting. It's close to those acupuncture-sized needles, and it's attached to the external part of the ear. It's very discreet. It stays on for 5 days. And what it does is it stimulates the nerves that create a lot of the detox symptoms that so many people are fearful of, and including anxiety, insomnia, rapid heart rate, increased blood pressure, perspiring, and pain. It's really a painful process to go through coming off of those opiate medications, or as I said, fentanyl, heroin, those type of substances. So this allows individuals to safely withdraw painfully, and it takes in without a medication. You know, it's a beautiful cutting edge alternative. Historically, we've only had a certain pathway. So patients and families and providers have really only had medication to give for an addiction problem. Here we have an alternative that is non-pharmacological to treat the detox symptoms when people are coming off these types of medications or drugs.
So this is FDA cleared. And you operate with something called the Clinical Opiate Withdrawal Scale, or COWS, which basically shows how badly someone is feeling as they're going through this. And you say the scores got so much better in under an hour using this.
It's absolutely incredible. And I'll tell you, Kara, one of the most incredible things I've witnessed as a provider in this space, applying this device right on the ear. Aware Recovery Care does this in the home. We're an in-home addiction treatment program. So we do an assessment on the individual to see where they are. We want to make sure that they're in active withdrawal, and we apply the device right in the safe and comfort of their own home. As I said, it's very discreet so that people really can't even see what they're going through. And within actually 10 minutes, you see a decrease in the COWS score. That score is similar to what we would use as a pain score, so it was 0 to 10. This one is a little bit more larger scale, but we'll see a reduction within the first 10 minutes of 75%. After an hour, you see a 95% reduction in COWS score. And that is just remarkable with something non-pharmacological in this space.
And you've even done some studies with Yale as well. And talk a little bit about, I guess after you go through detox, there's still more to go. It's just the tough time is getting through that, what could be really painful detox. So you're seeing that this is helping people actually cross the finish line to recovery.
Absolutely. And so one of the things that is so difficult for individuals that are facing this is that withdrawal process. It's painful, it's scary, it's very uncomfortable for anyone going through it. So this allows a complete abstinence process from start until you can enter treatment. And the study that we did with Yale was a case study, and we looked at these individuals that we placed the device on. What was their response to the device? What was their percentage that transferred into treatment? And 100% of the patients that we applied this device to transferred into treatment. And as you mentioned, this is just the beginning, the first step in a long process. But what we do at Aware so beautifully is that we treat the family in their home with the patient all as a treatment team. And so this allows the patient to go from active withdrawal right into that addresses all of those withdrawal symptoms. So many individuals don't go to the process of treatment because the withdrawal symptoms are just so significant, and they're often under medicated. And you know what ST Genesis and Speranza has done is created a non-pharmacological treatment for the detox portion of this program that doesn't have to be on another medication. And so many times patients and the family members, they're terrified of another medication to be, entered into this patient's life. And so this is a beautiful opportunity to get them into treatment.
So if people are hearing this, and I know, just to give people an idea of the opioid crisis, we hear about it in the news all the time. But this isn't just people who are, addicts living on the fringes of society. We've watched principals, moms, dads. I mean, many people have fallen victim to be addicted to these opioids, these painkillers that were often overprescribed and are struggling now. So can you explain a little bit about who could benefit from this?
Absolutely. And I'm so glad that you said that. The addiction does not discriminate. Everyone, every one of us knows someone, a family member, a loved one, even in our own family, that this is just widespread. And it's often started out with a prescription, prescription pain medication. So, of course, no one wakes up and says, the rest of their life, they hope that they become addicted to this medication. Oftentimes there's real pain in the beginning and that the medication is just then continued. Stopping coming off of some of these strong medications can be quite abrasive for individuals if they're not tapered off and if they're not properly prescribed medication that treats their pain. So sometimes if the medication is cut off, they will start using illicit substances. And then they're on a pathway that is just very, very dangerous. There's such lethality out there with the fentanyl and, fentanyl laced with different types. There's over 600 different types of analogs of fentanyl. The crisis is so significant now, and the lethality of the drugs that are out there are so severe that we've had to come up with something different because what we've been doing clearly is not working. So what we do is we take an assessment of the individual to see if they'll be inclusive or exclusive of criteria for this device. Majority of individuals are appropriate for this device.
Yeah, just give me a little idea of that, who would be a great candidate and maybe who wouldn't.
The great candidate would be somebody, obviously, who was going through active opiate withdrawal. The primary diagnosis needs to be substance use disorder, and you need to have the opiate withdrawal. That would be the primary diagnosis. Not a lot of medical comorbidities. Even if you do have a lot of medical comorbidities, it may work. The beauty of this is that you don't have to worry about medication interaction. Oftentimes when we're going through, having a patient prescribed medication for detox, sometimes they're on multiple medications and there's drug-drug interactions. There's no concern of that right now whatsoever with this. So we treat individuals over the age of 18, as old as 72 years old. So any of those individuals, we've had a myriad, male, female, like I said, with other medical comorbidities. And the device actually is also very good for pain. So a lot of the individuals that are on these medications have chronic long-term pain. And this is an opportunity for them to address that as well.
And the great thing is sometimes your insurance is going to cover this in many cases?
That's correct.
Tell me a little bit about that, because people are going to think, oh, this sounds good, but I don't know if I can afford it.
Well, Aware Recovery Care is covered through Anthem Blue Cross and Blue Shield in the state of Connecticut. So there you have that possibility to go through. And then if you have other insurance, we can look at seeing if we can do a single case agreement to get that covered. The cost of it is not that expensive either. So if your insurance does not cover that, we can offer a payment plan for you that would be reasonable.
Oh, okay, because it's drug-free and it's a little device, it's not going to be something that nobody could afford.
Correct.
Now, do you help the folks too? I mean, I know this is an in-home program, but it's not like you just give them the device and say, hey, figure it out. I mean, this is a very guided, gentle, effective program.
Absolutely. So what we do is we'll have an initial evaluation, as I said, with a medical doctor or nurse practitioner. They'll make sure that you are eligible for and don't have anything that would be a criteria that would not meet this device. They'll have a nurse that will come into the home and they place it on your ear. And it's very specific. You actually have to find the nerves in the ear to attach it to. So it has to be in the right location. And it's the device is placed behind the ear, and then the needles are right on the ear. Very, very small, but it has to be precisely placed by a provider that's trained to be able to do it.
But it's actually going to the root of the problem, because it's actually stimulating the nerves in your brain, right? So where your brain would be causing these extreme reactions, it's short-circuiting it, for lack of a better explanation, but it's really going to the source. Is that right?
Absolutely. So those nerves, the main one that it'll stimulate is the vagus nerve. Vagus actually means wandering. So it's a nerve that's all over our body. And that's what helps with anxiety, heart rate, the perspiration. And we have other cranial nerves that it stimulates as well. And it's a constant stimulation that this will happen. It's not just the needles, but there is a nerve stimulator that happens. So it's constantly stimulating those nerves, even while you're asleep. And so people talk about sleeping better, their nutrition is better. They have first time that all of their symptoms are being addressed non-pharmacologically. Even individuals who've gone through withdrawal with medication say supersedes that feeling because they're not having any other side effects that medication causes. All medication has a side effect. So this gives you zero side effects whatsoever.
I mean, it's pretty incredible. We're watching the video right now, exactly how it's stimulating the brain, but it makes me wonder, I know it's not something you're doing right now, but has there been talk about using this for other things, for people with anxiety disorders, depression? Maybe they're not coming off drugs, but they're also needing help with a reset, so to speak?
Yes, there's actually a lot of work that being done around this device, how it can help with all things like you're talking about with anxiety, especially with acute situation, acute pain, insomnia. It helps with all of those different things. We all had an opportunity to use the device, to test it out. And I got to tell you that instantly when it was placed on my ear, I was calm. I needed to actually go lay down. It was so relaxing. It was an incredible experience. I mean, I was not going through the detox process, but just having it put on my ear, I instantly felt a calming sensation, relaxing, and I had one of the best night's sleeps I've ever had in my life with this device on.
You know, I've done some research and talked with other people about that, you know, your vagus nerve. And so this idea that there's kind of this switch in your body that could help you calm down is pretty exciting for people to know.
Oh, it's fascinating, and it's so exciting for patients, providers like myself, and for families to have, as I again said, something different besides another medication. Yeah. You know, I mean, we are looking at a massive drug problem, and we're throwing more medication at it. It's not working. We've got to do something different. And so programs like Aware that are cutting edge, doing something different, Speranza and ST Genesis, doing something different, looking at this, disrupting what's out there and saying, you know, we don't need to throw more medication at a medication problem or more drugs at a drug problem. It just makes sense to have something that's so unique and so different that is not addicting and it's not interacting in your body like it would with other medications.
Well, and effective, right? Because that's always people's concern about a more holistic or a drug-free thing is it going to work? And what you're saying is study after study has shown just incredible data with, like you said, 100% of people going on to recovery or 93% improving COWS scores. So wherever people are coming from, wherever they are on their journey, you're seeing it's working time and time again.
Every single time. I have not ever placed this on someone's ear that it did not have efficacy. It's just mind-blowing. The first young man that we put this on, he was very young, had a lot of pain, had a lot of dental issues. He'd been using substances for many years, fentanyl, and we placed it on his ear. He walked outside. 10 minutes later, he walked back inside and said, "What kind of hocus pocus is this?" I mean, he said, "This is the first time in my life I have had my withdrawal symptoms treated." And his family was in tears. His sister was like, "This is my brother that I missed." And I mean, so within minutes, it's not like it takes days or weeks. It's within minutes, this person is transformed and they're feeling hopeful, like, I can do this. I can get through this. To be part of something like that, it's incredible. It really is, Kara.
Absolutely. That's amazing. So the data is there, and I just want to let everyone know again, it's called the ST Genesis, right? And you can, if people are looking at this saying, I have a loved one, they need this, what do they do? What's step one?
AwareRecoveryCare.com. Call Aware, get to Aware Recovery Care. We can talk to you about what your insurance looks like. And if it doesn't suit us, we'll make sure that you get into treatment. We'll make sure that you get to whatever you need to do. One of the things that Aware prides itself on is that helping patients and families navigate that road through to recovery is so overwhelming, is so difficult. So regardless of what insurance you have, give us a call, visit our website. We can help you and your family navigate that difficult, painful road. We understand addiction like nobody else. We really do. And we want to help you and your loved ones get and find recovery.
So again, it's awarerecoverycare.com or 203-779-5799. I'm aware that this will go out over social media and people could be watching it who don't live in Connecticut. Is this device available in other places?
It absolutely is. Yeah. So wherever right now we're in New Hampshire, Maine, Rhode Island, Connecticut, Massachusetts. We just opened in Virginia, Florida, and Indiana. So we have multiple states and we have a pathway across the United States. We're not stopping until we're in every single state.
All right. Well, thank you so much, Dr. Shelley Halligan. We really appreciate it. And again, it's just checking out on the website. I'll just read it again one time. It is awarerecoverycare.com or 203-779-5799. We so appreciate you sharing this really incredible information with us.
Thank you so much for having me. I appreciate you discussing this very vital topic.
Yes, everyone out there, if you're watching this, if it's on my social media or it happens to be on the WFSB streaming app, feel free to share this with someone who could benefit. Thank you, Doctor, for being with us. You can find more episodes of Kara's Cures on the WFSB streaming app. You can also get more wellness information by joining the Kara's Cures Facebook group and follow me on social media. That's at Kara Sundlin. I'll make sure to post this there.